Good afternoon. Thank you so much for joining us. My name is Daryan Jones. I'm the Caregiver Education and Digital Specialist at Care Partners. We're here today with another Hot Topic live segment. We're going to be covering Medicare, how and when to enroll. We'll also be answering your questions. So we have Stephanie Salcedo from Secure Legacy is joining us again today. She'll be here. She has a ton of experience in this area, and we're just so grateful that she's taken the time to be here. Real quick before we get started, just want to let you guys know that our Sweet Charity event is actually coming up next week, June 11th at noon. So we'd love for all of you to tune in. You can tune into Facebook, YouTube, or on our website. We'll have it linked there as well. And be sure to share and spread the word with all of your friends. We just want to get as many people to watch as possible. And other than that, we're still continuing to provide online resources. So be sure to visit our website if you're ever in need of some help or resources or activities to do at home. There's tons of resources on our website, so we'd love for you to visit that. And today, we're just going to go ahead and introduce our guest, and then we'll go ahead and get started. Hello, Stephanie. How are you doing this morning or this afternoon?
I'm wonderful, Daryan. How are you today?
I'm great. We really appreciate you coming back again this week to talk again some more about Medicare. Again, I'm just going to have you tell us about yourself and some of your experience.
Great. Thank you so much, Daryan. Hello, friends. I'm Stephanie Salcedo again. Thank you for tuning in and watching this segment. And I'm going to try to do my very best to try to help you out with a few Medicare concerns. Medicare is quite confusing. It did take me a while to learn it, and every day I'm still learning something new. But I'm going to try to do my very best to guide you in the best way that I possibly can to try to make it easier as far as the frustrations that the baby boomer generation is going through right now. And I always like to start off with my questions because I get emails constantly on questions where people are confused and they're wanting to know the answers on what to do and how to do it and mistakes that they've made, unfortunately, and if there's any way that I can help correct their mistakes. But hopefully that's not the situation in your case, and I'm able to guide you and provide the support that you need today. Number one of the biggest mistakes that I would say that people tend to do is when they're coming off of their company Cobra versus get right onto Medicare. And that's one of the most important times that if you have turned 65, you're past 65, let's say you're 67 or 68 or what have you, and you're coming off of your company benefits, Medicare does not count Cobra as credible coverage. And the reason I'm bringing that up, because I have, who was it? Let's see, that was Ronald from Cyprus. So he's the Stephanie. I retired and I got onto my Cobra plan. And 8 months out, I realized that I had made a mistake. Now I'm getting penalized. What can you do to try to help me? So let me kind of share with you on the deadlines and times. Number one, when you come off of your credible coverage with your group company benefits, you have a 63-day window to enroll into what we call Part D, which is the prescription drug plan, 63 days. And you have an 8-month window to enroll into Part B. B is the Medicare, the medical part. And if you don't enroll when you're supposed to enroll, even if it's 8 months and 1 day, you will get penalized that premium Part B for not enrolling when you were supposed to enroll. So, you may think, well, 8 months, I got 8 months, let me go ahead and take a little trip, a vacation. I've been working on my life. I want to take some time off. I'll deal with Medicare when I get back. Well, here's what I'm going to tell you, folks. Don't deal with it when you get back. Get it done now. So therefore, you can go on your trip. You can go on your vacation if you decide to do so. And you don't have to worry or stress about your health care coverage. Medicare is going to be the most important healthcare coverage in your life that you're going to need now more than ever. So you want to make sure you get it done right. Because if you do get penalized, which, by the way, let's just say if you're 68 years old and you're retiring and you don't enroll during that 8-month window, it's a 10% penalty fee per year. So that can be 30% penalty. So very, very crucial, important for you to enroll because that's 30% for the rest of your life on top of your premium payment on Part B. On your prescription drug plan, that's different. It's 1% per month. So that would be 12%. So imagine, multiply that times whatever it is, 36 months or for 3 years, that's a penalty fee. So that's a fee that you're going to have for the rest of your life. So hopefully, Ronald, I've answered your question on that. Another bit of advice I'll give some of you that are on a Medicare plan, a Medicare supplement, excuse me. And by the way, folks, I forgot to mention, so let me mention this now. I am not endorsed with the Medicare federal government or the Social Security Administration office. I am an independent broker. And what sets me apart from the industry, from the insurance companies, is that you get all this junk in the mail and then you don't know which way to go. And it's confusing. So you don't know from one plan to another. And with an independent broker as myself, I'm able to guide you and see what's good for you and your budget. Do not go by what your friends say because you may not have the same health condition as your neighbor or your friends. You may not have the same finances as your friends or your neighbors. So don't go by what your friends say, okay? I always recommend go by if they recommend a good referral, a good source, a person of good information, then go by that. But don't go by what they're telling you as far as get on this plan or get on that plan, because what works for them may not always work for you. So just a bit of advice. If you were on a supplemental plan and you've been on it for a couple of years and you haven't had, your agent has not revised your plan, I recommend for you to do so, and more so on the prescription drugs. If you haven't already done so, every year you should definitely, if you're on a lot of medications, shop the market for a prescription drug plan just to see if they're still going to cover your prescription drugs. And if they are, the cost involved as far as how much you're going to pay each and every month, it's extremely important that you do that because unfortunately all plans are different when it comes to the prescription drug plans. And what I would do if I was you is go to Medicare.gov. Look it up on Medicare.gov and look at all the different prescription plans. And if you're needing some help or some guidance and you don't really know how to do that, you're more than welcome to reach out to me and I'll share that information with you and just guide you every step of the way. But I definitely recommend for you to look at your prescription drugs every year. And this would be during open enrollment. So that would be starting October the 15th through December the 7th. And so what I will tell each and every one of you is that if you're on a Medicare Advantage plan, that open enrollment pertains to you to check out different Medicare Advantage plans. But if you're on a supplemental insurance plan, leave your supplemental plan alone. Really, truly, honestly, look at your prescription drug plan. That's when it pertains to you. If you're paying a little bit too much or you think you're paying a little bit too much for your supplemental, you can also shop the market for that as well. Just an FYI for those of you who don't know that. Let's see. Stephanie, when should I enroll into Medicare? Is it age 62? The answer to that is no. 62 is when you become eligible for your Social Security benefits. And then, of course, keep in mind that's not full retirement age. So you will get a lesser amount of money each and every month. And I believe, if I'm not mistaken, it's 8%, 8 to 10% until you turn full retirement age. Which if you don't know that information, I would recommend for you to go to the socialsecurity.gov website, or you're welcome to reach out to me. But what I will share with you is this. You need to enroll into Medicare Part A and B if you are not covered under a group company benefit. So if you are retired, self-employed, or your employer does not provide any type of health coverage, then you need to apply 3 months before you turn 65. So that way it starts on the month of your birthday. So let's say, for example, your birthday is September the 1st, okay? Then your benefits are going to start the month before that, which is going to be July the 1st, because you're on the 1st of the month. But if you're on the 5th or the 10th or the 20th of September, let's say September, your benefits would start on the 1st of September. So if you are on, let's say, the 5th or the 20th of September, you need to enroll 3 months before that. It's a 7-month window, but here's what I'm going to share with you. You've got to get proactive, get on the ball, get it done, because if you do wait too long, then it's going to start at a later time. So if you wait till after the month of your birthday, you're looking at anywhere between 60 days to 100 days or 120 days, depending on each month that goes by. Just get it done. 3 months the day of your birthday. So let's say you're September the 5th. So your benefits will start September 1st, but you got August, July, and June. So come June 1st, you can enroll. So right now, all the people turning 65 in September, go ahead and start getting the ball rolling and get yourself enrolled. All right, let's see. Penalty fees, we've covered that. There's no penalty fees on Part A, but there is on Part B and there is on Part D. Okay, so very, very important. It says, Stephanie, how much am I going to pay for Part A? I've never worked a day in my life. I've been a homemaker. My husband has been the provider, and he's worked. What do I do, and how much am I supposed to pay? Well, here's what I'll tell you. You can apply on your husband's benefits because he's provided and he's worked all this time. So you can actually apply for Part A and B under your husband. As far as Part A, as long as he's got his 40 quarters, worked his 10 years, there's not going to be a fee for Part A. That's what he's paid into. Now, for some of you that are not married and or let's say didn't pay that much into Part A or into the system, then it just depends. I mean, I can't really tell you exactly what your premium would be. You'd have to check with the Social Security office and see how much that would be. Now, if you're having financial difficulties and you didn't work that much and you're still having trouble trying to make ends meet, of course, you can always apply for other government programs as well, any type of, like, let's say, extra help or Medicaid. I am not a Medicaid specialist, so I'd reach out to Social Security and they can go over that information with y'all. Stephanie, is there a fee with my Medicare plan? Well, here's what I'm going to tell you. There's Advantage plans and there's supplemental insurance plans. So they do differ. They are different. But one bit of advice that I can give each and every one of you on a supplement insurance, it's not going to be as expensive as what you are accustomed to paying on your health insurance needs, as far as whether it's on your company benefits or self-employed health insurance. So it's I would consider it being quite affordable compared to what the standard rates are right now for people that are turning 65. So just kind of what I would suggest is get with an agent who's able to shop the market for you on a supplement plan. And that's what I do. That's what I'm able to do for you. Look at the different carriers and see what's going to be affordable to fit your budget and your needs. And hopefully that answers your question. That's Susie out of Sugar Land. I think that pretty much wraps it up, Miss Daryan. Do you have any questions for me? Anybody in the audience have questions?
It looks like we don't have any questions just yet. So anyone at home who does have a question, be sure to type it in the comments. While we're waiting for that, can you briefly tell us what are some of the differences between Medicare and Medicaid?
Well, so I will tell you with Medicaid, and I'm not licensed Medicaid specialist. Medicaid is for those who are needing additional assistance. Okay, the extra help. You're on a fixed income. You're needing help with getting your prescriptions paid for, medical coverage. So the Medicaid is for someone who is a senior citizen on a fixed income. You do got to apply for that. And Medicare is just a government health insurance government program. So combine the two together. Medicare is your medical coverage, and then Medicaid kind of supplements to pick up cost and whatever you are needing. I hope that answers your question, Daryan, because I am not licensed for Medicaid. I wish I could give you more information on that. I do know that when people are needing additional assistance for assisted living or for different resources, and they don't have the funds, then they can apply for Medicaid to help offset those costs. People are always, a lot of folks that are needing help will get on what we call extra help, and that's also kind of like another avenue to help pay cover your prescription drugs or your expenses that are associated with your health care coverage. I hope that also answers your question. Do you have any other questions for me, Daryan?
Yeah. Are there any big Medicare myths that you would like to discuss right now?
I mean, the only thing is uh, I mean, the only thing that I will tell you is just the people that are coming off their company benefits right now. But as far as um, I don't know if I really understand your question as far as what you're trying to ask me, other than the confusion of people trying to get onto Medicare and making sure that their paperwork is all correct. For example, if they're coming off of company benefits, very, very important for people to have the request for employment information form, which it looks like this. And at the bottom, you can actually Google this. If you Google CMS dash L as in Larry 564, request for employment, that's one of the main things. A lot of people are confused when they're coming off of their company benefits. They don't know really the time frame that they have to enroll into Medicare. And because they're so excited about, coming off of retiring and being able to travel or do things that they've been waiting all their life to do, they tend to kind of put this on the back burner. And I've seen people get penalized because they have no clue that it's a 63-day window for their prescription drug plan. 8 months is fine, but they always base it off of 8 months, 8 months. So they get on their Cobra and they don't want to hassle with it till they get back. So that's one of the things that I can always, bit of advice I can give folks. Now, there is a fax number to the Social Security office. If for whatever reason you don't want to go into the Social Security office and you want to fax these forms in, that fax number is the 1833, right, the 914-2016. I always suggest and give advice to my clients and let them know, hey, listen, make a copy of what you're sending to Social Security and date it the time and day you sent it off, because it can definitely get lost. So that's something that can happen. Do you have any other questions, Miss Daryan?
Looks like we still don't have any comments. So anyone at home, be sure to just let us know. Yeah, what I meant by that question was really, what are some things that people think, oh, this is how Medicare works, but then you have to explain, no, it goes like this. Just some common misconceptions, I guess, was the question. But I mean, you sort of answered it, so.
Well, I kind of like at the beginning of the segment, I was saying, you can't go by what your friends are telling you. And what I've had people tell me is they'll say, I need a supplement. I need a supplement. But they don't really know if supplement insurance is very good, but, and I'm not trying to say Advantage isn't, but they'll say, I need a supplement. And then in actuality, they want an Advantage plan. So, there's a lot of folks out there that also think they're on the right plan. And so they start needing that medical coverage. And then they start to realize, oh, this is not what I thought it was going to be. So there's a lot of confusion. Unfortunately, people get a ton of junk in the mail and they just don't know. And I mean, it's difficult and it's confusing, and you get this Medicare book in the mail and the government, thinks you're able to read through it and kind of understand it. Unless you're doing it day in and day out and you're literally meeting with folks, it's confusing. It's very, very confusing. And the Medicare handbook, just so that y'all know, because a lot of people get confused with that, at the very back of the book, those are not supplemental plans. Those are Advantage plans. So it's important that you know that as well, because there's folks that'll hear from their friends that they need to supplement a supplement, and then they'll sign up with the plan That's in one of their Medicare handbooks, and that's the Medicare book that they send you. I don't think I have one here, but the one that they send you every year. So just be real careful because those are not supplements; those are Advantage plans. So hope that answers it, Ms.
Yeah,
Marion.
thank you so much. And just thank you so much again for being here today, Stephanie. I'm going to put your contact information up one more time. So anyone at home who has some more questions or just wants some more professional advice, be sure to reach out to Stephanie at one of these either phone numbers or email address or even on her website. So with that, I think we're going to wrap it up for today. But thank you again, everyone, for tuning in. And thank you again, Stephanie, for joining us.
Thank you so much. Thank you.
So,
have a good day.
yes, and everyone at home, have a great day as well. We will see you again very soon.